Now give me one confident answer. Let me see who will answer it. Common carotid artery and proximal part of the internal carotid artery, they are derived from which aortic arch? You know there is a first, second, third, fourth, sixth, no fifth. Okay, so which aortic arch gives what? That's good. Dr. Dilip says third, Vizag says third, Hyderabad says 1, nobody says 2. Yes, doctor. Stapedial artery, hyoid artery is second. Maxillary artery's first part is basically, part of maxillary artery is from first arch. Common carotid, proximal part of internal carotid is third. Aortic arch and proximal part of right subclavian is fourth. Proximal part of the pulmonary arteries and ductus arteriosus are from sixth. This is the first and last time you need to listen and go and answer in the tomorrow's exam. Emasculation can be caused by any of them but not by the loss of the testis of adult. All the other things are surgical and medical causes. Subarachnoid hemorrhage may be seen with any of them but not with alcoholic intoxication. Goodell signs 16 weeks. Syphilis in 9 to 10 days, and whenever you give atropine, 1 diopter or 2 diopters? 1. Now quickly shoot me an answer, doctor. Which branchial arch forms the anterior 2/3 of our tongue? Who will give me the correct answer? Once more, aortic arch, branchial arch and their derivatives. You have to be 100% sure. Entire embryology is the same story. Second is the answer from Guntur, Warangal, Dr. Padmaja, Anantapur and Dr. Varun. Everybody says first, second. Nobody say third. Eh? Okay. First branchial arch, anterior 2/3. Third and fourth arches form posterior 1/3, and that's the reason cranial nerve 9, which is the nerve of the third and fourth arches, supplies the posterior 1/3, and cranial nerve 5 sensation, cranial nerve 7 is the taste, is the first branchial arch, which is the anterior 2/3. Now how does alpha agonist basically act like an anti-glaucoma drug? Alpha agonists act by reducing the aqueous humor production instead of increasing their outflow. Coming to the leprosy, if you look at the uveitis, it is more common in the lepromatous form rather than tuberculoid form. Now coming to the various optic nerve diseases, if there is any problem in the macula, it only affects the visual acuity. So that is the reason the pupillary reaction is not affected much. Now, intraretinal microvascular abnormalities, what are they called? IRMA, are considered to be poor prognostic factors in case of non-proliferative diabetic retinopathy is what need to be remembered. Coats disease is another important entity. So, in the case of the Coats, it is not a hereditary condition and it is not associated with any systemic vascular abnormalities is what we need to fundamentally appreciate. Coats, other name given is retinal telangiectasia is the other name being given to it. It is also called Leber's-Millery aneurysms. Okay, doc. I am 100% sure you won't answer this question. Which week midgut herniates, which week it will come back into abdomen? They are scaring you about 20 marks in anatomy. Yeah, if this kind of question comes, you can relaxedly answer because for everybody it is only a guesswork. Not even guesswork. Favorite number is the answer. Why I have raised this question is to tell you that don't worry about the numbers in the another 8 weeks. If you are unable to remember the numbers or you are poor in remembering numbers, think that the warrior Karna is also a great warrior. He also had the same problem like you. In the real time, in the battlefield, he forgot the right number and right mantra. So, doesn't matter. Let me check. Dr. Madhavi says it is 10:12. Anantapur says 12:16. Vizag says 5:28. What is your lucky number? 6:10. 6th week and 10th week. Yeah, very close was the answer of Dr. Padmaja. Okay. Now, central serous retinopathy. You know, if you do fluorescent angiography, just like the smoke rises, smoke stack pattern it is called as. It is found in about only 10% of cases. Very mean question, right? First you need to know smoke stack pattern, where is it located? Now, 65-year-old undergone phacoemulsification of the lens. So what is this called as? Cystoid macular edema developing after cataract surgery is called Irving-Gass syndrome, is what need to be understood. Most of these cases will be resolving spontaneously. Irving-Gass syndrome, where after doing phacoemulsification of a cataractous lens, cystoid macular edema developing is a complication generally seen between 6 to 10 weeks post-operatively, is what need to be remembered. It is the Streptococcus pneumoniae, worldwide the most common cause leading to the development of microbial keratitis. Lymph node involvement is very common with Hodgkin's, everything, not vocal cords, because vocal cords don't have lymphatic drainage, is what need to be basically remembered. Eustachian tube. Some questions you can check it in the exam hall also. At least your next entrance aspirant year you can put the finger and check. 3.75 centimeters is the size. Now doctor, shoot me an answer. Bilateral renal agenesis with oligohydramnios with pulmonary hypoplasia, malformation of ureteric bud. What is this classical syndrome called as? Who will give me the correct answer? Alport from Hyderabad is not right. Potter given by Dr. Sudha, Dilip, Navya, Deepthi, Madhuri and our Guntur students, right? That's the correct answer. Potters, babies who can't pee in the utero will develop Potter. Another way to remember, renal agenesis and Potter need to be understood. Inner ear, it is typically present in the petrous part of the temporal bone. Then it is the 10th cranial nerve, vagus, which supplies all that parasympathetic innervation which will initiate the cough response whenever your ear is getting cleaned. Now, frontal sinus basically drains into the middle meatus, and a smoker, hemoptysis, bronchoscopy shows a growth in the distal trachea. You will only think of squamous cell carcinoma, which is very common there. Now T1, M0, N0 stage, if the carcinoma larynx patient presented, how do you want to basically treat? So T1 stage means it is confined to vocal cords with a normal mobility. If there is no loss of mobility of the vocal cords, if you give radiotherapy, 90% of times there is an improvement. That's the reason radiotherapy is the best treatment that you can offer to a patient of T1, N0, M0 is what need to be remembered. Should be an answer, doctor. Bulbourethral glands of Cowper, you all know, no? Bartholin's glands, Skene's glands, prostate gland, all of them are derived from one embryological structure. Which is that? We all passed just like that in anatomy, because after finishing botany, zoology, after getting seat in MBBS, we thought life is glorious. But after discovering anterior, posterior, medial, lateral, very good. One big clap to Dr. Deepthi comes up here. Urogenital sinus. So doctor, this table you are not going to forget, you will remember me in exam. Genital tubercle gives rise to corpus cavernosum, glands, vestibular bulbs and clitoris. Urogenital sinus, Cowper's glands, prostate gland, Skene's glands. Urogenital folds, labia minora and labioscrotal swelling, labia majora and scrotum. These fine things we feel we know, but examiner will put a Solomon's knife and check it in the exam hall, do we know or not? Out of all, it is the glottic cancer, very sensitive to radiotherapy. T1 N0 M0, I think it is the same repeat, X-ray beam radiotherapy. What is Burkinsonian bias? It is the different rates of admission to the hospital. Suppose if you are a peripheral hospital, super specialty hospital, out of 100 patients in the OPD, 95 patients are heart attack patients. It doesn't mean in the entire Hyderabad city, every 95 out of 100 have heart attack. It is because of the referral effect. There is a bias in statistics, which is called Burkinsonian bias. Now, tell me, doctor, shoot me an answer. Which organism? It is typically grown on EMB agar. It will lead to blue-black colonies with a metallic sheen. It is a lactose fermenting organism, which is gram-negative. Too many clues, eh? Which lead to blue-black colonies with a metallic sheen on a EMB agar. Microbiology and the smell of agar plates is going to haunt you in 15 questions. Be very sure. Earlier state entrance only 6. Dr. Sudha guessed it, Klebsiella. Anantapur said Bacteroides. But Vizag and Guntur are the winners of the answer, where they said E. coli. That's right, doctor. E. coli. It forms pink colonies on McConkey, and on EMB agar it will lead to blue-black colonies with a metallic sheen, is what you are going to ultimately remember. Now, what is not a primary air pollutant? First to know pollution only, big deal. MD entrance ke liye pollution, what is the relationship, doctor? Too much, no? In that you must know primary pollutants, secondary pollutants. Nonsense, no? Another 8 weeks we will have this nonsense. Ozone is secondary air pollutant. And all the remaining given here are primary air pollutants. Now, occupational cancer commonly is a skin cancer. Vaccine with the maximum efficacy will be a measles vaccine, almost 100% efficacy. What is Rome scheme, doctor? Reorientation of the medical education without NEET exam was proposed long back by Srinivas. But later on, Srinivas number 2 has changed it into NEET. So be very sure, the Vastav will keep changing. So Srivastav committee, Rome. Last pages, no? Kartar Singh committee, Srivastav committee. पढ़ना है और एक 8 weeks पढ़ के बाद में जिंदगी भर you can forget about it.